Good evening, everyone, and thank you again for joining in this session. We are back with another informative session on medical cannabis, and one of the leading organization in our company, that is Bombay Hemp Company, is supporting us in this initiative. We are very much thankful to them to ensure that the spread of the knowledge, the spread of the ethical knowledge in an ethical way among the professional community, that is doctors, should be there on a consistent manner. And that is very, very important because medical cannabis is still at a very initial level in terms of getting infused in the medical practice of the clinicians. And we have very few clinicians right now in India who are very much interested and focused on this domain and are practicing. However, with the efforts, with the companies like Boheco, Bombay Ham Company, and with some doctors like we have Dr. Prashant today, I think the number is growing now gradually, which is again will be benefiting to the patients because this is one of the solution which I see personally in our clinic, that giving excellent solutions to the patients in many aspects. So without wasting much time, I think you are very much excited and awaiting to listen Dr. Prashant, Jahan, and some inputs will be shared by my end as well in the later part of this session today. So I again welcome Dr. Prashant Jain. He is the founder of Nirmal Ayurveda, and he will be delivering a talk today on the cannabis-based medicine role as far as the anxiety and stress disorders are concerned. And we again welcome Mr. Jahan Preston Jamas from Bombay Hem Company. He's the founder of Boheco, one of the co-founder of Boheco, and started this organization way like so many years back, where nobody at that time was aware about medical cannabis, and now leading from the front in many aspects as far as medical cannabis practice and domain is concerned in our country. So again, thanks Jahan for your time, for your involvement in these kind of sessions to ensure that knowledge is getting spread across the community, across the fraternity about medical cannabis. And as far as anxiety and stress is concerned, I think this is one of the drug of choice. In many cases, we have seen that people are suffering, still suffering from so many issues. With due respect to all the pathies and all the options available, still there is no permanent solution, or there is no healing in terms of a significant healing is concerned, and there are so many side effects of whatever the chemical based solutions people are taking. And sometimes now people are coming as a mindset they have that they don't want to get into any kind of an treatment where there are side effects, where there are chemicals. So they need something which is herbal, they need something which is plant based, but on the same note it has to be effective. Can we replace any medicine with all the strong sedatives and the patient can sleep from the day one? Can be replaced on the anti-anxiety drugs, or the whatever the drugs they are taking for their anxiety and stress, and from the day one the patient is getting relief, the patient is getting the efficacy. That was the question. No doubt in Ayurveda we have so many herbs, but that like effect from the day one is not that much possible. But with medical cannabis we have seen that tremendously, and from the day one patients are withdrawing their existing medicines and they are switching on to the medical cannabis and they are getting relief. That is very important and significant aspect we need to understand as a clinician, because especially in the practice, in the private practice, we need to deal these kind of aspects, that today nobody has time, nobody has patience. They need fast results with safety and efficacy. So I think that is the key factor, the key responsible factor for medical cannabis to be getting like to be getting absorbed, to be getting increased in the fraternity, in the practice, and the patients also are giving this feedback. So on that note, I will hand over the session to Dr. Prashant. Prior to that, I will quickly request Jahan to have some introductory remarks, as they are dealing with these kind of issues and these kind of solutions also from so many years. So maybe your introductory remark on this, Jahan, and then we will hand over the session to Dr. Prashant for his talk today. And thank you again, both of you, for joining. Please.
Thank you so much, Dr. Piyush. And once again, it's a great pleasure to be a part of such a platform and work very closely to be able to, with practitioners like yourself and Dr. Prashant, to be able to enhance and enable more knowledge to the Ayurvedic medical practitioner community, particularly around Vijaya or cannabis based medicines, jahan pe we are seeing there is more and more need for education and awareness at practitioner as well as patients end, keeping in mind the rising amount of I would say demand for such products, particularly in a post COVID-19 world where mood, stress, neurotic related and anxiety related disorders have become a lot more prevalent or more common. People are a lot more aware of the problems that then the challenges they're dealing with, and it adds in very perfectly vis-a-vis a lot of the global research that's happened. Whether we're speaking about research like clinical studies done at the Department of Neuroscience in University of Chicago, or whether done at University of Sussex or other universities in the United Kingdom and North America, जहाँ पे they have shown कि full spectrum cannabis where using THC and CBD with the right dosage optimization has actually worked for a range of, I would say, acute psychosocial stress disorders, post traumatic stress disorders, and a range of anxiety disorders. So, on that note, again, briefly from our side, it's been a pleasure on behalf of Bohiko to be a part and empower such platforms along with yourself and Dr. Prashant. And greatly looking forward to a fascinating set of presentation by Dr. Prashant on the topic area for the day as well.
Good
Thank you,
evening, and
Jahan. Yeah, and I request now Dr. Prashant Jain to please deliver his talk. And I request all of you who are watching this session, you can post your queries and questions in the comment section. We are right now live on YouTube, Facebook, LinkedIn, and many other platforms as well. So you can post your query on the comment section. We will, as soon as Dr. Prashant will conclude his session, we will take up the questions and accordingly we can have the discussion with all of you. Thank you.
thank you, Piyush sir, and thank you, Jahan, for inviting me over the session today. And we would be discussing here what is anxiety and stress, and how we can help out other patients to deal with the anxiety and stress based on the medical cannabis. Sorry. So let's start with first. And before starting, we must clarify some facts about the general population. It's the facts and myth in the general population that whether cannabis is addictive or cannabis is intoxicating, legal or illegal, or anyone can prescribe cannabis medicine, or there are certain specific practitioners who can prescribe cannabis medicines. And how can you prescribe a cannabis medicine when it induce intoxication? These were the some questions which was raised by my patients itself, and based on that only I am explaining these today. So cannabis, yes, cannabis is addictive, but when we'll speak about cannabis medicines, then they are not. So until unless you are under the prescription, you are under the guidance of a doctor, you are under the guidance of a registered Ayurvedic practitioner. Till then, these medicines are not addictive. But yeah, definitely, if a patient start abusing them and they are using for the recreational purpose, then definitely it may become addictive. Second thing is cannabis is intoxicating. Cannabis is intoxicating, but cannabis medicines are not. So when you'll take the medicine in a proper dosage prescribed by your Ayurveda doctor, then they are not intoxicating. They will help you out. Legal or illegal, when we speak about the medicines, they are completely legal. But when you speak about the recreational purposes, those definitely that's an illegal process. And does anyone can prescribe a cannabis medicine? No, it's not possible that anyone cannot prescribe a cannabis medicine. Cannabis medicines comes under the purview of Ayurveda doctors only. It manufactures under the Ayush drug license only. So these can be prescribed by only Ayurveda doctors, not anyone. So anyone cannot prescribe a cannabis medicine. Now, another question comes, when it is an intoxicating drug, then how can you prescribe it? So, the same thing, when we prescribe a medicine, when we prescribe cannabis in a medicinal form, then it's not intoxicating. It will definitely give it its effects. It will help you to heal, but it is not intoxicating. Overuse of anything can be intoxicating. For example, if you'll take sugar in too much quantity, that also will give you sugar rush. So when sugar can give you a rush, it is a medicine. Definitely, it will give some sort of intoxication, but not that much that you can't cope up with that. So whenever you are taking any kind of cannabis medicine, please take under the supervision of a registered Ayurvedic medical practitioner. Don't take any medicine by yourself. It is not about cannabis medicine, it is about each and every medicine of Ayurveda. Whatever medicine you are taking, it is very much required that you take under a medical supervision only. So next we will proceed with the today's topic, which is anxiety or stress. So what Ayurveda says about anxiety or stress? We were dealing with the ancient view and the modern view, Western view. So ancient view is Ayurveda only. So when we'll speak about Ayurveda, Ayurveda says Isha Shok Bhaya Krodh Man Dveshadascha Ye Mano Vikaraste Apyukta Sarve Pradya Pradaja, which says that all the disorders which are present, all the psychiatric disorders, everything or psychological disorders or a psychosomatic disorder or a somatic disorder, everything origins out due to Prajnaparad. Prajnaparad says, Dhi Dhriti Smriti Vibramsha Kurute Karm Kurute Yat Ashubham Sarva. So means when your intellectuals, your decision making power get disturbed, then only you will end up in the diseases. And on the other hand, when they say for the treatment, then it says Manasam Parati Bhaishajyam Trivargasya Anavekshanam Tadvidya Seva Vigyanam Atma Dinam Cha Sarvashaha. Here also they have specifically mentioned Tadvidya Seva. Tadvidya Seva means the person who have knowledge of Manas Roga, who have knowledge of Ayurveda, who have knowledge of medicine, you should take any medicine by his guidance only. Don't take any medicine by of your own. So this is the message I want to convey here through the text as well, that whatever is the treatment should be done under the guidance of a medical practitioner, of a doctor, of a Vaidya only. Don't take any medication without the supervision of any doctor. So, when we speak about the anxiety, so anxiety is an umbrella term which comes with many other aspects as well. It is not only anxiety. Anxiety comes with anxiety only, or it is a generalized anxiety disorder, or it is a post-traumatic stress disorder, or maybe it may be phobia, it may be social anxiety disorder, it may be a panic disorder. These all comes under the anxiety group of disorders. So, anxiety defines as apprehension of fear. One anxiety is that we will generally see in day-to-day life, and another is a generalized anxiety disorder, which happens to most of the people, and it is a long process. Anxiety can occur to each and everyone at any stage of life. That's not a disorder. You don't need treatment for that. But when it becomes a disorder, it hampers your social life, it hampers your personal life, then it becomes a disorder, and then it is mandatory to take a treatment for that. So the same things we would be discussing again and again in the complete session. Likewise, I mentioned panic disorder. It is the extension of anxiety. First, you will get the anxiety. Later on, when you are not able to deal with that, you will get the symptoms of panicky, which will be like sweating, heart rush, palpitations, panic situations like sweat. You will be not able to get comfortable in the situation where you are at that time, and you want to escape it from that situation as soon as possible, and you are not able to do so. So that call as panic disorders. Similarly, post-traumatic disorders are those one in which a person have experienced some sort of trauma, some sort of incident, and following which he started ignoring the situations which are similar to that particular event. So here we come with the anxiety disorder. It's not anxiety; it is anxiety disorder. It is most frequently, what we have said, that it is generally diagnosed in the population, and it does occur with some of the other psychiatric disorders as well in the 50% of the cases, and that would be mostly depression. So depression and anxiety will co-occur with each other. And the same, if we consider men to women ratio, so women are 2 times more likely to get anxiety disorders than that of a man. So they are at verge, and that must be kept in mind. Why we call it as a disorder? Because it will definitely hamper your quality of life. Again and again, it indulges in your life and stop you to function normally as compared to the society. Now when we'll come to the cannabis, so yeah, definitely cannabis does helps in anxiety. If a person is getting anxiety at a point, at that time, if you'll prescribe him a cannabis in a prescribed dosage, definitely it will help in the anxiety. But here the question is whether it is also helpful in anxiety disorders, or it is just for the anxiety only. So this is the question we would be dealing in the further presentation, and hopefully by the last we will get the answer for the same, right? So when we come to the anxiety disorders, like we said earlier, it is a group of disorders which comes with the panic disorder, generalized anxiety disorder, social anxiety disorder, PTSD, post-traumatic anxiety disorder, stress disorder, agoraphobia, separation anxiety, mutism, OCD, or acute stress disorder or phobia. So all these things comes under the group of anxiety disorders itself. So it's a very big group of disorders, and in general, we will see all these things. One or the other person who is facing all these all these disorders or suffering from all these disorders, and we can help them out through this presentation or this interaction with all of you. So I hope, apart from doctor, general public is also watching these presentations, and they, if you identify any one of the person who is facing all these issues, then definitely you can refer them to the Ayurveda practitioners, and they can help them out to come out of these problems. Now, what's a panic disorder? Panic disorder is an extreme anxiety reaction. Like a person is having an anxiety attack, that he's thinking too much of something, and all of a sudden that anxiety peaks up. And when it peaks up, then it will get converted to a panic disorder. And at that time, it is called as a panic attack. So, what happens in that? Panic attacks are characterized by sudden and repeated periods of overwhelming anxiety and fear, a feeling of being out of control, or fear of death or doom. Physical symptoms like palpitation, sweating, chills, shaking, trouble breathing, weakness, dizziness, tingling of numbs and hands, chest pain, stomach pain. And definitely, a panic disorder can mimic a heart attack, it can mimic a paralysis. So at that point, it is very much necessary for a physician to make the right diagnosis and treat accordingly. Sometimes, if a patient is actually having a cardiac arrest or heart attack, and he's a patient of panic disorder as well, so we misdiagnose. Sometimes it get mixed diagnosed as a panic disorder, but that's a state of emergency. And if a person is having any sort of panic attack, at that time, prior importance should be given to rule out all other possibilities which will be having same presentation as that of a panic disorder, right? So generalized anxiety disorder, it is a clinical description, is like shift from crisis to crisis, and patient worry about a very small things which they even know that these things are not to be worried about, but still they worry about them very much. Statistics, if we say, then it's a prevalence of 3.1% to 5.7% lifetime prevalence is there for anxiety disorders, and it the rate is similar worldwide. It's not like in India it is more or America it is less. It is same everywhere. It generally starts in the early adulthood. It develops slowly, and it's a very chronic course. It's not like a person comes to you and just have an anxiety disorder and it got treated by the very next day. So that's why they need proper follow up. They need proper medication, and those medication would be under the prescription only. So the characteristics of generalized anxiety disorder would be too much worry. They know that they are worrying too much. Have a troubling falling asleep, staying asleep, restlessness, उनका जो they are not able to concentrate more on their task or works, trembling, twitching, irritation. There are many more. So n number of descriptions are there, characteristics are there. We can't even list them out. I have tried to list them out very few, but if you will see, then n number of possibilities can be there. So what is now again another thing, that social anxiety disorder? It is basically a disorder only, but anxiety specifically which happens in a social gathering. A person tries to avoid to go to a social gathering. They are uncomfortable to present. If someone asks to do something, they are not comfortable with that thing, and it mainly happens in the social groups. So people with social anxiety disorder worry about the situation for weeks before they happen, avoid from places or events where they think they might have to do something but will embarrass them, and feel nauseous or sick to their stomach, show a rigid body posture, make little eye contact, speak very softly, find it scary and difficult to be with other people, and sweat, tremble. All the features of anxiety would be there, but it happens in a specific gathering, or when they have to go on a stage or they have to speak publicly. In those settings, mostly it occurs. The same post next comes with the post-traumatic disorder. So post-traumatic disorder, traumatic stress disorder, occurs when a person experiences some sort of trauma, and which would be very scary for him, and he takes much time to come out of it. See, in general, what happens whenever a person comes across a trauma, so we need approximately 1 or 2 days to come out of that particular area or that particular trauma. But in post-traumatic stress disorder, that those persons are not able to come out of that particular area of traumatization, and it continues for a very long time, more than a 3 months, and still they'll get fear of those situations, and they avoid to going such a wherever they find that this situation is gonna happen, they avoid those situations to go into. So, post-traumatic disorders, they generally involves continuation stress, fear, anxiety problems long after the danger has passed. And the symptoms usually begin within 3 months of the traumatic incident, but can begin later and must last more than a month. And some people recover very fast, but some may take more time, and it will lead to the chronic exposure of the same. So many of the people would be wondering why we are going through all these things. What is general anxiety or social anxiety or post-traumatic disorder or phobia? So the reason being here, until unless we will diagnose the patient correctly, we would be knowing the exact condition of the patient, whether he is having general anxiety or only anxiety at the time. Anxiety at the time can be cured easily, but if a patient is having a disorder, and in that which type of disorder it is. See, for example, post-traumatic disorder, stress disorder is such a thing in which patient need much more counseling, much more attention, much more time of the doctor, and the vigorous treatment planning. Similarly, if a patient is having panic attack, we must identify whether it is only a panic attack or there is something else is also going on, because it sometimes mimic with other disorders, cardiac arrest or paralysis attack as well. So the understanding of the disease, understanding of the psychological state of the patient is very important. That's why we are discussing all these things in detail. If we would be knowing the matter that how we can differentiate between the exact condition or a psychological condition, then only we will proceed further. In psychiatry also, it is well said that whenever you are making any diagnosis, psychological diagnosis, first rule out all the other possible causative factors or somatic factors. If a patient is having any presentation of a pain, and we diagnose it as a only psychological pain, but before that, all the causative factors of pain in that particular area must be ruled out. Until unless you rule out all the positive factors which could be possible, which could be inducing that pain, don't diagnose it as a psychological pain. So coming to a psychological diagnosis is very, very difficult and very, very important to rule out all the possibilities before we make a psychological diagnosis. So that's why understanding the course of the disease, understanding the manifestation of the disease, process of the disease is very important to make it a psychological diagnosis. So when we speak of the epidemiology of GAD, it is about 4 to 7%, which we have discussed, and the mean age of onset is approximately 30 years. And more women are twicely as likely to get a GAD than that of a man. Right? Estimated risk for developing PTSD based on event. If we'll see the which event will lead to PTSD, post-traumatic stress disorder. So these are the some figures, like patient who have been having an incident of rape, they are 49%, beating or physical assault 31.9%, sexual assault 23.7%, serious accident or injury, that would be 16.8%, shooting or stabbing 15%, sudden unexpected death of a family member or a friend, so 14%, child's life threatening illness 10%, and so on. It may go on continuously. So, how do we understand GAD? So, what are the factors which will lead to GAD? Every disease does have a factors due to which it is occurring. So, when GAD we'll speak about, so specifics we don't know. Everything is hypothesized, but it is seen in mostly patients that these changes have been seen. So, if a patient is having, if a family is having a problem of anxiety, it is likely that the kids of that family would be having anxiety disorders. Changes in the brain neurotransmitters like GABA, recent and prolonged exposure to stressful situations, childhood trauma, maladaptive cognitions, assumptions, situation person is unsafe until proven safe, always best to assume the worst. Researchers have repeatedly found that people with GAD have maladaptive assumptions, and they speak about the danger as well. So when we'll see the biologically perspective of panic or anxiety, so there would be an increase in norepinephrine from the sympathetic nervous system, increases the rate of contractions in the heart. Along with epinephrine, norepinephrine also underlies the fight or flight response, directly increasing heart rate, and which will misfire the fight and flight mechanism. The fight and flight mechanism is always present in our body, which occurs for a very small example. If you are in a jungle and you encounter a lion, सो उस समय पे फाइट एंड फ्लाइट मैकेनिज्म एक्टिवेट होना कॉमन है, और वहां पे हमारे को एपिनेफ्रिन और एपिनेफ्रिन की वजह से फाइट एंड फ्लाइट मैकेनिज्म एक्टिवेट होता है और हम वहां से जल्दी निकलने की कोशिश करते हैं. बट इफ यू आर सिटिंग इन अ सिचुएशन एंड वहां पे ऐसा कोई भी स्ट्रेसर नहीं है, कोई भी चीज नहीं है, उस समय पे फाइट एंड फ्लाइट मैकेनिज्म अगर एक्टिवेट होता है तो दैट्स नॉट नॉर्मल, दैट्स abnormal. दैट्स व्हाई इट occurs एज अ जनरलाइज्ड एंजाइटी और अ पैनिक अटैक. अगर हम अनदर फंक्शन देखते हैं तो यहाँ पे फंक्शन आता है एमिगडाला और लिम्बिक सिस्टम का. सो एमिगडाला एंड लिम्बिक सिस्टम प्लेज अ वेरी 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 क्रूशियल रोल इन द मैनिफेस्टेशन ऑफ ऑल द डिसऑर्डर्स एंड एक्सपीरियंस ऑफ फियर. अगर एमिगडाला और लिम्बिक सिस्टम में कोई डिस्टर्बेंस है तो उसकी वजह से वो फियर का एप्रीहेंशन जो है उसे ओवर एस्टिमेट कर देते हैं. जैसे ही वो ओवर एस्टिमेट होगा तो फाइट एंड फ्लाइट मैकेनिज्म एक्टिवेट होगा और उसकी वजह से हमारे को एंग्जाइटी और ये सारी चीजें होनी शुरू हो जाती है. कुछ शेयर्ड कंपोनेंट्स हैं जो सारे ही एंग्जाइटी डिसऑर्डर्स में कॉमन होते हैं. फॉर एग्जांपल, फियर इज वेरी मच कॉमन इन ऑल द एंग्जाइटी डिसऑर्डर, इधर में भी जनरलाइज्ड एंग्जाइटी और पैनिक डिसऑर्डर, पोस्ट ट्रॉमेटिक डिसऑर्डर, फोबिया. तो जितने भी हैं उसमें फियर का स्टिमुलस कॉमन होता है. मिस इंटरप्रिटेशन ऑफ थ्रेट होता है. थ्रेट जो एक्चुअली में है, जिसे हम एक्चुअली परसीव कर रहे हैं, पेशेंट्स हु आर हैविंग एंग्जाइटी डिसऑर्डर्स वो उसी थ्रेट को बहुत ज्यादा परसीव करते हैं, लाइक मोर देन 10 टाइम्स या 20 टाइम्स से परसीव करते हैं, जिसकी वजह से उन्हें एंग्जाइटी होनी शुरू होती है. अवॉइड करते हैं सिचुएशंस को, उन सिचुएशंस में जाना. दे अवॉइड दो सिचुएशन जिस सिचुएशन में कुछ भी उन्हें लगता है कि शायद ऐसा कोई ट्रिगर फैक्टर हो जो एंग्जाइटी को फिर दोबारा से प्रोवोक कर दे. और एब्सेंस ऑफ करेक्टिव लर्निंग. इन जनरल व्हाट हैपेंस, हमारे को कोई चीज बताई जाती है, एक पर्सन नॉर्मल पर्सन है, उसे आप बताते हो कि ये सिचुएशन इतनी ज्यादा दिक्कत वाली नहीं है, और हम उसे समझ लेते हैं. सो नेक्स्ट टाइम व्हेन वी एनकाउंटर द सेम सिचुएशन, वी वुड बी इन अ स्टेज कि हमारे को पता है दैट दिस इज नॉट दैट मच डेंजरस, या इसमें इतना खतरा नहीं है, तो हम उसे इजीली कोप अप कर सकते हैं. बट इन द पेशेंट्स जिनको एंग्जाइटी डिसऑर्डर्स है, उनमें वो करेक्टिव लर्निंग की जो होती है वो एब्सेंस होते हैं, मतलब वो करेक्टिव लर्निंग कर नहीं पाते. वो सेम सिचुएशन को जितनी बार भी एनकाउंटर करेंगे उतनी बार उसे सेम सर्कमस्टांसेस में देखते हैं और सेम ही एंग्जाइटी उन्हें एक्सपीरियंस होती है, राइट. तो नाउ व्हेन विल कम टू द ट्रीटमेंट, कौन सी ट्रीटमेंट है जो इफेक्टिव है एंग्जाइटी डिसऑर्डर्स के लिए और कैसे वो काम करती हैं. तो दो तरह से एंग्जाइटी का ट्रीटमेंट होता है. फर्स्ट इज फार्माकोलॉजिकल, हम दवाइयों की मदद से ट्रीट करते हैं एंग्जाइटी को. अनदर वन इज साइकोसोशल ट्रीटमेंट, जिसमें थेरेपीज होती हैं, जैसे सीबीटी है, एसीटी है, माइंडफुलनेस है, ग्रुप थेरेपी है, एक्सपोजर थेरेपी है, डीबीटी है, डीप ब्रेन स्टिमुलेशन थेरेपीज अलग होती हैं. तो ये सारी अलग अलग थेरेपीज हैं जो दी जाती हैं पेशेंट्स को इन वेस्टर्न पर्सपेक्टिव. तो उसके अंदर सबसे पहले अगर हम बात करते हैं एसएसआरआईज की और एसएनआरआईज की, विच इज सिलेक्टिव सेरोटोनिन रीअपटेक इनहिबिटर्स और सिलेक्टिव नॉन एपिनेफ्रिन रीअपटेक इनहिबिटर्स. हमने जैसे पहले बात भी करी, एपिनेफ्रिन एंड नॉन एपिनेफ्रिन ये दोनों एक क्रूशियल रोल प्ले करते हैं एंग्जाइटी डिसऑर्डर्स में. इनकी ज्यादा प्रोडक्शन से फाइट एंड फ्लाइट मैकेनिज्म एक्टिवेट होता है. वो मैकेनिज्म एक्टिवेट होने की वजह से वहां पे एंग्जाइटी का लेवल और ज्यादा बढ़ जाता है. तो जैसे ही हम इनको प्रिस्क्राइब करते हैं तो ये क्या करते हैं, सीरोटोनिन का रीअपटेक को रोक देते हैं. सीरोटोनिन का रीअपटेक रुकने की वजह से न्यूरोट्रांसमीटर्स रिलैक्स होना शुरू होते हैं. सिमिलरली नॉन एपिनेफ्रिन का रीअपटेक स्टॉप हो जाता है, जिसकी वजह से फाइट एंड फ्लाइट मैकेनिज्म जो है वो डीएक्टिवेट होना शुरू होता है और पेशेंट काम होना शुरू हो जाता है. बेंजोडायज़ेपिन्स जनरली सिडेटिव्स होते हैं, रिलैक्स करते हैं, मसल्स रिलैक्स करते हैं. इसकी वजह से वो एंग्जाइटी को रिलैक्स करते हैं, कम करते हैं, मूड को इंप्रूव करते हैं. फास्ट एक्टिंग होते हैं, बट इनके सबसे बड़ी प्रॉब्लम बेंजोडायज़ेपिन्स के साथ है कि वो हैबिट फॉर्मिंग होते हैं, मतलब एडिक्टिव होते हैं. एक बार पर्सन ने लेना शुरू करा बेंजोडायज़ेपिन्स, देन वो हर टाइम जब भी उसे एंग्जाइटी होगी, ही इज हैविंग ओनली वन ऑप्शन, दैट टू टेक अ बेंजोडायज़ेपिन. अब्यूज होने के चांसेस बढ़ जाते हैं क्योंकि रिलैक्स करता है, मूड को अपलिफ्ट कर देता है. इस वजह से लोग इसे पेशेंट्स अब्यूज करना शुरू कर देते हैं. और अगर किसी को ऑलरेडी एडिक्शन हिस्ट्री है तो उसके अंदर तो बेंजोडायज़ेपिन्स देने में सबसे ज्यादा प्रॉब्लम रहती है. नेक्स्ट बीटा ब्लॉकर्स की बात करते हैं. तो बीटा ब्लॉकर्स हार्ट रेट को डिक्रीज करते हैं एंड ये जनरली यूज करे जाते हैं जहाँ पे परफॉर्मेंस एंग्जाइटी होती है, मतलब ऑन द स्टैंस यूज करने के लिए होते हैं. रेगुलरली हम इसे नहीं देते बिकॉज हार्ट रेट को ये इतना स्लो कर देगा रेगुलरली अगर हम देंगे, सो दैट कि वो हार्ट रेट हैम्पर होना शुरू हो जाएगा एंड कार्डियक मैनिफेस्टेशन स्टार्ट हो सकती है. कैनाबिस एंड एंग्जाइटी की अगर बात करते हैं, सो नाउ द टॉपिक कम्स कि कैसे, हाउ वी कैन रिलेट कैनाबिस एंड एंग्जाइटी एंड हाउ कैनाबिस हेल्प्स टू कोप अप विद द एंग्जाइटी एंड एंग्जाइटी सिचुएशंस. So I would be explaining this based on the few studies which have already been conducted by the different authors. So one systematic review study was conducted in 2009. So उसमें हमें ये मिला कि जो frequent cannabis users हैं, they have high prevalence of anxiety disorders एंड एंजाइटी डिसऑर्डर्स के भी जो पेशेंट है उनमें भी कैनबिस यूज जो है वो ज्यादा मिला है। बट ये कोई भी रिलेशन वहां पे सेट नहीं कर पाए या कुछ भी कंक्लूजन नहीं हो पाए कि कैनबिस की वजह से एंजाइटी ज्यादा है या एंजाइटी की वजह से कैनबिस यूज ज्यादा हो रहा है। इसके अंदर इसीलिए वहां पे एक फिर कंक्लूजन दिया गया कि न्यूरोबायोलॉजिकल और एनवायरमेंटल एंड सोशल इन्फ्लुएंसेस जो भी है उनको ध्यान में रखने की जरूरत है। सो यहाँ पे जो सबसे हमारा एक क्वेश्चन है कि कैनबिस की वजह से क्या एंजाइटी होती है या एंजाइटी की वजह से कैनबिस यूज बढ़ता है, ये यहाँ पे नलीफाई हो जाता है। रीजन बीइंग कि इसका कोई भी एविडेंस नहीं है कि कैनबिस की वजह से एंजाइटी बढ़ती हो। सो फर्दर हमने जब उसके ऊपर रिसर्च करा, वो आगे हम डिस्कस करेंगे कि क्या कैनबिस की वजह से एंजाइटी बढ़ती है, और उसके अंदर हमारे को बहुत अलग अलग तरह से और वंडरफुल रिजल्ट्स मिले भी हैं। तो THC as a treatment for anxiety. So under specific conditions and at lower dose, THC has been shown to have anxiolytic, antidepressant and hypnotic effect in certain patient populations. उसी को ध्यान में रखते हुए आगे जब उसके ऊपर टेस्ट करे गए तो सिर्फ THC से टेस्ट किया गया। THC हैव शोन कंडीशंस कि लोअर डोजेज में जब उसे एडमिनिस्टर करा गया तो उसने एंग्जियोलाइटिक इफेक्ट दिया, एंटी डिप्रेसेंट और हिप्नोटिक इफेक्ट दिया, जिससे एंग्जाइटी पेशेंट्स की कम हुई। बट ऑन द कॉन्ट्ररी जब सेम ही THC को हाई डोजेज में देने की कोशिश करी गई, हाई डोजेज में दिया, तो उसने वहां पे पैनिक, पैरानोइया और एंग्जाइटी के सिम्टम्स को बढ़ा दिया। सो अनदर पॉइंट कम्स हियर कि अगर हमारे को मेडिसिन देनी है कैनबिस की तो वो मीटर्ड डोज में होनी चाहिए, सेल्फ मेडिकेशन कभी नहीं करना। इसलिए मैं रिपीटेडली कह रहा हूँ कभी भी सेल्फ मेडिकेशन नहीं होना चाहिए। मीटर डोज अंडर द सुपरविजन ऑफ अ मेडिकल प्रैक्टिशनर ओनली यू शुड टेक द मेडिसिन। So the same thing, chronic exposure to higher doses of THC may also have negative effects on anxiety. See, sometimes what happen, जब हमने एंजाइटी का ट्रीटमेंट के लिए किसी पेशेंट को कोई भी मेडिकल कैनबिस की मेडिसिन दी है, टिंचर्स और इन मे बी टैबलेट्स और समथिंग, जनरली क्या होता है, उनको एंजाइटी हुई, उन्होंने मेडिसिन ली और वो एंजाइटी कम हो गई। सो नेक्स्ट टाइम अगर उनको एंजाइटी ज्यादा होती है तो दे टेंड टू टेक मोर ऑफ द मेडिसिन। तो वहां पे ये नहीं होना चाहिए कि वो अगर हाई डोजेज में मेडिसिन लेंगे तो डेफिनेटली उसका कहीं ना कुछ साइड इफेक्ट आ सकते हैं। तो बेसिकली अगर आप मेडिसिन ले रहे हैं तो वो डॉक्टर के सुपरविजन में लेंगे, इट विल हेल्प यू आउट, डेफिनेटली इट विल हेल्प यू आउट। अपने आप सेल्फ मेडिकेशन ना करें। तो व्हाट अबाउट CBD? नाउ वी हैव स्पोकन अबाउट द THC, और अब CBD का क्या रोल है एंजाइटी डिसऑर्डर्स की ट्रीटमेंट में। सो एनिमल स्टडीज हुई हैं व्हिच सजेस्ट CBD हैज एंग्जियोलाइटिक प्रॉपर्टीज। Review of human studies in 2015 found that CBD may be helpful for treating anxiety disorders. CBD reserves anxiogenic effects of THC. CBD reduces experimentally induced anxiety of fear. CBD reduces anxiety associated with simulated public speaking test in healthy subjects and in social anxiety disorders. CBD enhances extinction of fear memories in healthy volunteers. See, extinction of fear means जब भी हम किसी भी पेशेंट को कोई भी थेरेपी इंड्यूस करते हैं, इधर इट मे बी CBD और इट मे बी माइंडफुलनेस, तो वहां पे एक्सटिंक्शन ऑफ फियर देखते हैं, क्योंकि जो फियर है, एप्रीहेंशन ऑफ फियर इज एंजाइटी। तो वो फियर जो है उनका, हम जब नॉर्मली बात करते हैं कि हम उसको अडाप्ट कर लेते हैं, वही सेम इफेक्ट CBD ने शो करा। जब CBD पेशेंट्स को दिया गया तो उन्होंने उस इफेक्ट को अडाप्ट कर लिया। ठीक है। ह्यूमन स्टडीज सपोर्ट्स द एंग्जियोलाइटिक रोल ऑफ CBD। नाउ CBD कैसे एक्ट करता है, इसका एक बेसिकली एक समझाने की कोशिश करी गई। CBD रिड्यूसेस एंजाइटी वाया FHT1A एंड इनडायरेक्ट कैनाबिनॉइड रिसेप्टर एक्टिवेशन पैराडिज्म assessing innate response to threat. CBD appears to regulate emotional memory processing in humans and in animals. तो हमारा जो इमोशनल फैक्टर है, जिसको प्रोसेस करता है, जिसकी वजह से एंजाइटी होती है, वो उसको रेगुलेट करने में मदद करता है, जिसकी वजह से हम बेटर एंजाइटी कंट्रोल कर पाते हैं। तो CBD inhibits the FAH and this is completely pharmacological, but there's definitely CBD helps to treat the anxiety disorder. So clinical evidence, if we'll see, so human clinical evidence, randomized double-blind placebo-controlled between subjects, design comparing synthetic THC to placebo in 29 healthy adults. So subject underwent standard Pavlovian fear conditioning and extinction paradigm, received THC to placebo before extinction. तो इसमें क्या हुआ था कि एक 29 हेल्थी एडल्ट्स के ग्रुप बनाए गए जिसमें प्लेसिबो एडमिनिस्टर किया गया और THC एडमिनिस्टर किया गया। दोनों के जब ग्रुप्स को कंपेयर करा गया, फियर कंडीशनिंग, पैविलियन कंडीशनिंग को देखते हुए कि जिसमें फियर की एडेप्टेशन बढ़ रही थी, फियर को लोग बाग एक्सेप्ट कर रहे थे, उसमें पता लगा कि कंपेयर टू प्लेसिबो THC सब्जेक्ट शोड लोअर फियर रिस्पॉन्स टू प्रीवियस एक्सटिंग्विश स्टिमुलस 24 आफ्टर एक्सटिंक्शन लर्निंग। जब उनको लर्निंग करी गई तो उसमें THC वाला जो ग्रुप था उसकी फियर एडेप्टेशन मच बेटर थी प्लेसिबो से। तो दिस इज अ गोल्ड स्टैंडर्ड स्टडी जिसमें प्लेसिबो कंट्रोल्ड क्लिनिकल ट्रायल करा गया था ये, एंड दिस दे हैव फाउंड दैट THC इन लो डोजेज इज वेरी मच बेनिफिशियल इन काउंटरैक्टिंग द एंजाइटी डिसऑर्डर्स. So this is about the Western world. We will discuss something about the Ayurveda as well. कि आयुर्वेदा में कैसे हम इसको देखते हैं या आयुर्वेद ने कैसे भांग को दिया है. तो हम अगर फर्स्ट पे देखते हैं तो उसमें बोला गया था मेडिसिन के रिलेटेड भी. तो त्रिवर्गस्य अन्वेक्षणम तद्विद्य सेवा. अगर डॉक्टर अपनी युक्ति के अनुसार जब मेडिसिन देता है पेशेंट को तो वो मेडिसिन का इफेक्ट आता है. सिमिलरली ये मेडिसिन अगर हम देखते हैं अलग अलग निघंटू में विजया के बारे में या भांग के बारे में या कैनबिस के बारे में अलग अलग बातें कही गई हैं. सो अगर कायदेव निघंटू की हम देखते हैं, कायदेव निघंटू कहता है इट इज मदकृत और कफवातचित. मदकृत यहाँ पे हम कंसिडर कर, मदकृत का मतलब यहाँ पे है जो उसका एंग्जियोलाइटिक या हिप्नोटिक इफेक्ट है उससे. मदनपाल निघंटू कहता है पित्तला मोह मदकृत च अग्निवर्धिनी. मतलब पित्तल है, पित्त को बढ़ाती है, मोह देती है, थोड़ा सा ड्राउजीनेस करती है, मदकृत करती है, सिडेट करती है, और दीपन है, आपकी डाइजेस्टिव एंजाइम्स को इंप्रूव करती है. भाव प्रकाश निघंटू भी अगेन ये कहता है पित्तला मोह मद वाक वर्धिनी. तो मोह देती है, मंद वाक करती है. आपकी जो वॉइस है, एंजाइटी डिसऑर्डर में पेशेंट पैनिक ही फील करता है, रिपीटेडली एक ही चीज को रिपीट करता रहता है, तो वहां पे मंद वाक, आपकी जो वॉइस है उसको स्लो डाउन करती है, उसको इफेक्ट से आपका वाक शक्ति जो है उसको कम करती है. वही नहीं वर्धिनी, सेम हर जगह वो बोला गया कि अग्निवर्धा आपका दीपन करती है, आपकी डाइजेस्टिव फायर को इम्प्रूव करती है. सो दिस इज अबाउट आयुर्वेद, हाउ आयुर्वेदा सेज विद द एंजाइटी डिसऑर्डर्स, और उसमें कैसे हम कैनाबिस का जो रोल है पर्टिकुलरली उसको हम एक्सप्लेन कर सकते हैं. यहाँ पे हम अगर बात करते हैं कि एंजाइटी डिसऑर्डर्स आयुर्वेद में कहाँ बताए गए हैं, तो आयुर्वेद में सबसे पहले हम जब देखते हैं एंजाइटी डिसऑर्डर्स के बारे में, तो उसने जहाँ पे भी मानसिक डिसऑर्डर बताए हैं, मनोरोग जहाँ भी बताए हैं, वहाँ पे मनोरोग के अंदर ही अगर जब देखते हैं कि सिम्टम्स मनोरोग के क्या है, वो है ईर्ष्या. ईर्ष्या मतलब जलन होना, शोक, थोड़ा सा डिप्रेस्ड रहना, भय, पैनिक अटैक या फोबिया, क्रोध, एंगर आउटबर्स्ट जो एंजाइटी में जनरली देखने में मिलते हैं, मान द्वेष, किसी से घृणा होना या फिर ईर्ष्या होना, जेलसी होना, या किसी से एक एंगर का भाव रखना या किसी से सेपरेट होना, ये सारी द्वेष के अंदर आती हैं. तो ये कुछ मनोरोग के सिम्टम है जो जनरली सब मनोरोग में मिलते हैं. और अगर हम एंजाइटी डिसऑर्डर्स की बात करते हैं तो एंजाइटी डिसऑर्डर्स में भी सेम ही हमारे को सिम्टम्स या सेम लक्षण देखने को मिलते हैं. और उसी के आधार पर जब हम ट्रीटमेंट की बात करते हैं तो ट्रीटमेंट में आती है मानसम प्रति भैषज्यम त्रिवर्गस्य अन्वेक्षणम. मतलब मन में भैषज्य भी देनी है. भैषज्य का मतलब होता है दवाइयां देनी है. त्रिवर्ग, धर्म, अर्थ, काम, इन तीनों का नॉलेज प्रॉपर होनी चाहिए पेशेंट को. जो हमने अभी बात करी कि आपका धर्म क्या है, आपका कर्म क्या है, तो वो सारी चीजें, आपका अर्थ क्या है, वो सारी चीजों की नॉलेज पेशेंट को देना. ये कौन देगा? ये देगा तद्विद. तद्विद मतलब जो उस सब्जेक्ट में एक्सपर्ट हो, जो आयुर्वेद में एक्सपर्ट है, जो आयुर्वेदिक मानस रोग में एक्सपर्ट है, वो आपको इन सारी चीजों का ज्ञान देगा. सो ये बेसिकली कहाँ पे आता है, जो हमने फार्माकोलॉजी, यहाँ पे देखिए दोनों ही आयुर्वेद ने बात करी है, भैषज्य की भी बात करी है और तद्विद्य सेवा और त्रिवर्ग की भी बात करी है. तो त्रिवर्ग की बात और तद्विद्य सेवा की बात आती है आपकी जब हम थेरेपीज देते हैं, CBT देते हैं या फिर ग्रुप थेरेपी देते हैं, काउंसलिंग करते हैं, ग्रुपिंग थेरेपी है, माइंडफुलनेस है, ये सारी आती हैं त्रिवर्गस्य अन्वेक्षण में. धर्म, अर्थ, काम का ज्ञान होना, तद्विद की सेवा करना. और फार्माकोलॉजिकल ट्रीटमेंट में आता है भैषज्य. भैषज्य मतलब मेडिसिन, वो फार्माकोलॉजिकल ट्रीटमेंट में आता है. तो इन दोनों की ही मदद से साइकोलॉजिकल डिसऑर्डर्स को ट्रीट करा जाता है आयुर्वेद में. बहुत सारे मेध्य रसायन आयुर्वेद में अलग अलग जगह पे बताए गए हैं जो सब लेने चाहिए, और वो भी मेध्य रसायन भी जैसे ही जैसे आपको एडवाइस करे जाएंगे वैसे वैसे लें. यहाँ पे सबसे मेन रोल कैनाबिस का क्या आता है, वो ये आता है कि कैनाबिस योगवाही प्रॉपर्टी को फॉलो करता है. मतलब ये जिस भी मेडिसिन के साथ अगर आप इसे कंबाइन कर देते हैं तो ये उस मेडिसिन की एफिकेसी को और उसके मोड ऑफ एक्शन को भी बढ़ा देता है. अपना मोड ऑफ एक्शन तो इसका है ही, बट ये अपार्ट फ्रॉम दैट दूसरी मेडिसिन के साथ कंबाइन होके और उनके मोड ऑफ एक्शन को, उनकी एफिकेसी को इंप्रूव कर देता है. फॉर एग्जाम्पल, आपके पास कोई भी एक पेशेंट है जो एंजाइटी डिसऑर्डर का है या किसी भी साइकोलॉजिकल डिसऑर्डर का, इवन सोमेटिक डिसऑर्डर, कोई फिजिकल डिसऑर्डर भी है उसे, उस पेशेंट को आप जैसे ही कोई भी मेडिसिन देते हैं और उसके साथ कैनाबिस की कोई एक मेडिसिन को ऐड करते हैं तो वहां पे वो उसके रिजल्ट्स को बढ़ा देता है. लेकिन मेक श्योर कैनाबिस के कुछ कॉन्ट्राइंडिकेशन भी हैं जो स्ट्रेस और एंजाइटी डिसऑर्डर्स में ही है. फॉर एग्जांपल, जो कैनाबिस का सबसे मेन कॉन्ट्राइंडिकेशन है वो ये है कि अगर कोई भी पेशेंट को मूड डिसऑर्डर्स हैं जैसे फॉर एग्जांपल उसको स्किज़ोफ्रेनिया है या फिर पैरानोइया है, पैरानॉइड डिसऑर्डर्स हैं, स्किज़ोफ्रेनिक डिसऑर्डर्स हैं, तो ऐसे डिसऑर्डर्स में बिल्कुल भी कैनाबिस की मेडिसिन का उपयोग ना करें। उस केस में वहाँ पे देयर आर वेरी मच हाई चांसेस कि उनके सिम्टम्स एग्रीवेट हो जाए। सो इस बात का जरूर ध्यान रखना है। बट अपार्ट फ्रॉम दैट, अगर पेशेंट को एंग्जाइटी है सिर्फ, या एंग्जाइटी ग्रुप ऑफ डिसऑर्डर्स है, वहाँ पे मीटर डोज के साथ हम अगर मेडिकल कैनाबिस को इस्तेमाल करते हैं, देन डेफिनेटली इट गिव्स वेरी वेरी गुड रिजल्ट्स। पेशेंट्स को समटाइम्स साइकोसोमेटिक डिसऑर्डर्स होते हैं जिसमें जो कॉज ऑफ द डिसीज है वो साइकोलॉजिकल है, बट जो प्रेजेंटेशन ऑफ द डिसीज है वो सोमेटिक है, यानी कि वो फिजिकल है। तो ऐसे केसेस में भी आप अगर मीटर डोज के साथ और रेगुलर प्रॉपर एडमिनिस्टर करते हैं विद अदर मेडिकेशन मेडिकल कैनबिस को, तो उसमें भी बहुत अच्छे रिजल्ट्स देखने को मिलते हैं। The main advantage we have in India is that we have a full spectrum medicines. So अगर हम बाहर देखते हैं तो वहाँ पे सीबीडी की सीबीडी है या फिर टीएचसी है, तो देयर दे फाइंड इट वेरी डिफिकल्ट कि वो किस तरह से सीबीडी और टीएचसी को किस रेशो में दे, सो दैट अटेन मैक्सिमम, दे कैन अटेन मैक्सिमम बेनिफिट। बट हमारे पास ये एक बहुत बड़ा एडवांटेज है कि हमारे पास फुल स्पेक्ट्रम है, हम सेपरेट नहीं करते सीबीडी और टीएचसी को, हम एज इट इज प्लांट को यूज कर सकते हैं। जब हम एज इट इज प्लांट को यूज करते हैं, अगर टीएचसी के कुछ नेगेटिव इफेक्ट्स भी आ रहे होते हैं, तो सीबीडी इज देयर विद अस विच काउंटरएक्ट दोस नेगेटिव इफेक्ट्स। तो डेफिनेटली इट वुड बी अ वेरी गुड कॉम्बिनेशन। अगर आप किसी भी मेद्य रसायन के साथ फॉर एग्जांपल ब्राह्मी वटी देते हैं, गिलोय देते हैं, शंख पुष्पी देते हैं, मंडूक पर्णी देते हैं, अगेन ब्राह्मी, शंख पुष्पी, मंडूक पर्णी, गिलोय, दे हैव डिफरेंट डिफरेंट रोल्स इन डिफरेंट डिफरेंट पोटेंसी इन डिफरेंट डिफरेंट प्रेजेंटेशन ऑफ द डिसीज। इट इज नॉट लाइक कि हर एक मेडिसिन में या हर एक केस में आप गिलोय ही दे सकते हैं या हर एक केस में ब्राह्मी दे सकते हैं। बट हाँ, डेफिनेटली अगर एंग्जाइटी ग्रुप ऑफ डिसऑर्डर्स हैं, स्ट्रेस है पेशेंट को, तो उन सभी में आप मेडिकल कैनबिस की डोजेज को ऑल्टर करके पेशेंट के अनुसार, पेशेंट की नीड के अनुसार आप उसको प्रिस्क्राइब कर सकते हैं। हर जगह गिलोय काम नहीं करेगी, साइकेट्रिक या सोशल साइकोसोमेटिक डिसऑर्डर्स में हर जगह मंडूक पर्णी काम नहीं करती, हर जगह ज्योतिषमती काम नहीं करता, हर जगह ब्राह्मी काम नहीं करती। बट कैनबिस एक ऐसी मेडिसिन है जो सभी में इक्वली काम करती है, सिर्फ उसकी डोजेज को मॉडरेशन करने की जरूरत है। डोजेज मॉडरेशन पेशेंट की प्रेजेंटेशन के ऊपर, उसके सिम्टम्स के ऊपर डिपेंड करता है। दैट इज द युक्ति, युक्तिस्तु योजना यातु युज्यते, दैट इज द युक्ति ऑफ वैद्य, कि वो किस हिसाब से उस डोजेज को मॉडिफाई करता है, ऑल्टर करता है और पेशेंट को प्रिस्क्राइब करता है, सो दैट ही कैन गेन द मैक्सिमम बेनिफिट फ्रॉम द मेडिकेशन। तो इसी के साथ अगर किसी कुछ है जिसको डाउट्स हैं वो हम क्लियर करते हैं।
Hi, Dr. Prashant. I think, first of all, very comprehensive and voluminous engagement today, and thank you so much for actually breaking it down in different realms, different ways. I believe, particularly from understanding how GAD, SAD, PTSD work at a fundamental level, and particularly how this links into modern day science, as well as I would say Ayurvedic references, and particularly how these two align towards certain ailment indication areas, and how all of those harmonize towards cannabis's medical based use. I think Dr. Piyush has also joined us right now, and I think we have a couple of questions that have come in as well. Hi, Dr. Piyush, do we have you with us?
Yeah, sorry. Yes, Jahan, I'm here, but I think your video is a bit stuck. We are not able to see your video. I think.
Yeah, I think Dr. There may be some issue at Dr. Piyush's end. Yeah.
Hello.
Ye- Yes, hi, doctor.
Yeah, Jahan, I think your video is stuck. I think maybe you can just check quickly. We are not able to
Okay.
see your video.
Yes, Dr. Piyush, is this better?
Yeah, now better. Great.
Okay, great, great.
So first of all, thank you, Dr. Prashad. It was really a very informative talk, and you have covered all the aspects as far as the anxiety and stress aspects disorders are concerned in the allopathic aspects, the various pathologies, the reasons, and you have also covered the Ayurveda aspects as well. We have several queries and several questions, and I was reviewing the entire session. At some point of time, more than 430 people were watching this live. So really, it was a very good session and very informative session. And I again thanks all of you for supporting us on regular basis. So quickly, let's have some questions as far as this particular session is concerned. First of all, I would like to request one thing here. The problem is we need to understand. So there is a different vision or a different perspective when we understand cannabis in terms of the scientific research or the allopathic or the modern parameters are concerned. And there is a very different and a separate approach when we need to understand cannabis with respect to the Ayurveda fundamentals or like Vijaya we are talking about. So one aspect, as mentioned by Dr. Prashant about Yog Vahi, or I will coin that as a catalyst. However, some audience are confused and they are posting some specific query that if we are giving with the allopathic drugs, sometimes we need to be very cautious and it can have drug-drug interaction. Then how you can say that it enhance the effect of the drug? So we are not saying it will enhance the effect of allopathic drugs. We are saying the bioavailability or the absorption or the effect of the plant-based solutions which we are giving along with cannabis, which we are giving the other herbs with cannabis, that will be improved. So what Dr. Prashant meant is when somebody is taking Ayurveda medicines and along with that if somebody is taking cannabis, in that scenario it will ensure the better sometimes absorption, it will ensure the efficacy will be enhanced. So in that context, that Yog Vahi or the catalyst aspect has been mentioned and has been referred here, right, Dr. Prashant? I think you have mentioned in the Ayurveda context, not in the allopathic
Yes.
context.
No, it's purely the Ayurveda because we are dealing
Yeah.
with the
So
Ayurvedic
so
treatments here.
great. Yeah. So my request is there are several contraindications as far as the allopathic medicines are concerned, like so many anti-epileptic drugs, so many SSRIs, sedatives. So we need to definitely make sure that whenever some patient is taking these kind of medicines or drugs, as far as the allopathic system is concerned, we are not supposed to give them the cannabis. Along with that, there has to be some kind of a gap or some kind of a like window period or some kind of a washout also, which all of you I request please consult your respective doctor and accordingly you can take it forward. That is point number one. And the second question is, see again, we need to understand as far as cannabis is concerned, uh, there are several aspects in terms of Ayurveda and there are several aspects in terms of allopathic system, and we are trying to combine both of them. So it's not that Ayurveda follow the DSM classification which like one audience raise like they are asking today. So it's like we are understanding in the allopathic or the modern parameters and we are understanding in the Ayurveda perspective. So we are just trying to combine both the aspects and both the theories and both the approach here, and in that way we need to understand in a better way. However, on the same note, the classification systems, the tools, the questionnaires, the scoring criterias, or be it the pathological reports, x-rays, diagnostic, I don't think so any pathy is should have that claim. It's purely a science, it's purely a research. So any pathy we need to when justify the efficacy. For example, uh, recently we are involved in one research, and what we are doing is in insomnia we are tracking the quality by 2 3 tools. Like we are tracking the quality by the scores. There are international scores to track the quality of the sleep and the quantity of the sleep. That is point number one. Second, there are so many gadgets. In fact, your simple smartwatch these days, your simple fitness band these days can track your REM, can track your quality of sleep. If you can just check your latest gadgets and all, so you can track that. So by tracking that, we can ensure that okay, after inducing cannabis, this is improved, and that is an evidence. That is an evidence, and that is a proof of an efficacy. So if you are using some classification systems, if you are using some modern parameters or tools to analyze the efficacy of a plant-based solution of a herb, I don't think so there is an issue in that. So in that note, we need to be progressive in terms of thinking is concerned. That is my only request to all of you, so that it will at least see this entire world will only believe when we show them the results. Like for example, another question was there about the THC or about the full spectrum thing. And Dr. Prashant beautifully mentioned that it's a very simple thing which we need to understand here. And many times in past also in many sessions it has been discussed. THC when in lower dose given under a medical supervision is beneficial. THC when taken in a higher dose in a recreational way is harmful. So and in research studies also, when you refer certain research studies, specifically in anxiety and stress issues, in lower dose it is beneficial, in higher dose it is elevating or increasing the issues, right? So that we need to understand, and to that extent anything can be harmful when it is giving when it has been taken out of the proportion or out of the dosage as well. And in India, as Dr. Prashant mentioned, and let me just clarify quickly, the medicines which we are getting is from the leaf extract. And um, as far as the cannabis medicines are concerned, we are not supposed to prepare medicines or get the medicines till now from the flower or bud part of the plant. So in that way, the THC is still at a very minimum level as compared to the flower or bud part is concerned. There, the mostly the recreational aspect or the aspect where people are more concerned about the harmful effects of cannabis in terms of the anxiety and stress is concerned. So that we need to understand, and accordingly we need to like many patients sometimes ask us ki, this is bhang, this is like cannabis, this is marijuana which you are giving to us. Then how you can claim that on one side we are suffering from psychological disorders and this is causing psychological disorders, this is causing addiction to the people, and you are giving us some kind of this kind of a medicine or this kind of a solution where it is responsible for causing addiction. So again, let me clarify, if it is given judicially under medical supervision with a low dose, it will definitely benefit, it will not harm to that extent. uh, on that note, maybe anything else, Dr. Prashant, Jahan, you want to add on? We have a couple of more questions I will put across, but prior to that, maybe I want to have some inputs from Jahan also in this entire discussion.
Absolutely. I think, thank you so much, Dr. Piyush. That's been extremely helpful and very valuable for a breakdown, and particularly off the back of the extensive insight that provided by Dr. Prashant. I think, particularly from the Bohico end, even one of our products, that is our Canada Release Stress Management, actually recently got its CTRI approval for a study in stress and anxiety based disorders post COVID. And, that's where we're seeing that there is active interest. From patients and users who are now being recently diagnosed, as well as ones that are looking to move away from conventional benzodiazepines. For example, some of our products, we've had several patients in the past who successfully weaned off, say, clonazepam. That they were using for about 8 years or 10 years, and it hasn't compromised their sleep at all, to such a point that they have spread the word amongst their fellow community of patients, but also their community, which is now also the modern medical practitioners. Your psychiatrists, mental health counselors themselves also peering over to see the great work being done. From the experience of Ayurvedic practitioners like yourselves, Dr. Piyush and Dr. Prashant, and I think that's a great testimony to the information and the real time. I would say case success that is happening in India, which acts in great harmony towards a lot of the global research. In fact, Dr. Prashant touched upon so many of them that are certain trials. And I think, dose titration and metering your dose is the most critical factor, particularly when dealing with full spectrum cannabis leaf based products. As Dr. Prashant mentioned, the difference between anxiolytic and anxiogenic in THC is a matter of 5 mg. That at 7.5 mg, you're having an anxiolytic effect, stress kind of relieving effect, but you go to 12.5 mg, and this is basis global clinical literature and clinical trial information. That's when it has that anxiogenic effect and sets a patient off. So I think, these insights are going to be very valuable for a whole host of practitioners who are listening in on a Friday evening, trying to understand how they can help their patients better.
Yes, absolutely, Jahan. I think you very well mentioned about this, and again, I want to take this aspect like specifically about the full spectrum. So, yes, in India, predominantly the medicines are full spectrum, the like cannabis solutions which we are having, and somehow full spectrum is like showing the benefits in terms of the overall psychological health issues are concerned as compared to the specific isolates. However, there are some indications if we are talking about their isolates are having some good results as well. For example, the specifically if you are talking about pediatric epilepsy and some other disease, which we can always take on in another session. That is one thing. Now there are a couple of more questions, Dr. Prashant. In fact, I would like you to answer, as
Sure,
you
sir.
have already taken some good initiatives in this domain, and today you are our main keynote speaker as well. So, can cannabis be used as pre-operative sedative medicine? So, that is one question from Dr. Parikshit.
Dr. Parishit, good evening. So, cannabis can be taken as a pre-operative sedative medicine, but not currently, because to take a medicine as a pre-operative sedative, it needs to be conducted. Research must have been conducted, and the dose has to be fixed. So, currently, the titration dosage has to be titrated, and for once we can't say right now that it can be as a sedative medicine, but yes, definitely in the future, definitely we will come across that it will be considered under as a sedative. In the ancient times, it used to be used as a sedative medicine, but not currently. So, looking further in the future, definitely we can include it as a sedative medicine.
Just to add on to this, see, as far as sedation, I think what you meant is using this as a replacement of the whatever
Anesthesia.
anesthesias we are using. It is a GA or LA and all. So on one side, yes, we need to still wait for maybe some more years to take this to at that level, but that this has the potential of replacing, which I think Dr. Prashant very well mentioned, that was going on in the ancient years. Second is the post-operative management and the post-operative post-surgery, basically the pain management and other issues are concerned, where already there are some surgeons who are connected to us, and we got this feedback that they have started using cannabis as a replacement of the painkillers, as a replacement of the anti-inflammatories, or sometimes it is having the efficacy in terms of managing certain kind of infections as well. There was one recent study where the drug resistant strains have been shown some kind of sensitivity to uh, cannabis medicines also. But this is again in the right now in the stage of evolution in terms of the research studies are concerned. But yes, there are some preliminary information that they are sensitive to the cannabis, which are resistant to most of the antibiotics and any other solution in the allopathic system as far as the superbugs or the multi-drug resistance infections are concerned. So that is again being practiced now with some surgeons we are talking, and along with whatever standard of care, they are using cannabis for pain management, they are using cannabis for certain kind of infections management and all, and we are getting good feedback. But yes, these are some initial days of that level of precision we required, and companies like Boheco are developing some great products in pipeline as well to reach to that kind of specific results and the precision which we are talking about in terms of the pre or post operative surgical procedures are concerned, and to help in those scenarios as far as the specific medicines are concerned. One more aspect which we need to understand here is pre-operative or post-operative. Some For some extent and some duration, patients are nil orally, so there has to be injectables. There has to be those kind of medicines where we can give through the IV or through that kind of mode rather than the oral or the and other modes are concerned. And predominantly right now in India, in fact, not in India, in the entire world, the medicines are uh, in the route. The route of administration is either vape, oral, or sublingual or local application, and these kind of medicines. So till the time we have a drug delivery system which is intravenous or that kind of mechanism we need to develop as far as cannabis is concerned, that pre and post operative care will be a bit challenge in the acute phase of time. But yes, when patient is recovering and when patient has been allowed to take oral medicines or fluids and food and all, at that time we can introduce cannabis for the post surgical management, and in the pre also, not exactly just before the surgery, but few days prior, if somebody is planning surgery, I recommend, and we have seen in some patients we have given. So that also can be one mode in which we can take it forward. Now the next question again, maybe Dr. Prashant, if you can throw some light, if you have an idea, or Jahan is also having some exposure. So the question is, vape method is very famous in abroad. I have heard and seen as well, but right now in India, it's not uh, there. So Jahan, what do you think that when we expect that vape method is also being adopted as far as Indian regulatory or Indian
I
mechanism
think
is
also
concerned?
just to touch on this, Dr. Piyush, in fact, there is a clinical study being conducted at Tata Memorial Center using the vape or vaporization method, where the vape was brought in as a registered medical device from a European country, where it was used for previous clinical studies as well, where even the material, that is the cannabis flower, is being imported to be vaporized to assess how this would work on stage 2 breast cancer patients perioperative. Interestingly enough, that we've been speaking about this, and that is where they're anticipating good results. I believe the study is commencing recruitment sometime this year. There were a couple of regulatory hurdles due to COVID, but it was actually the first pharmaceutical grade DCGI approved clinical study using the cannabis flower in a pharmaceutical setting. And that is where, of course, this was sort of an extraordinary case where the vaporizer, in this case, was registered as a medical device or a health device for particularly ingestion, where bioavailability, as we know, is very high through vaporization, and that's where onset time drastically reduces, the effects drastically increase. But I believe there is a lot more, I would say, general regulatory issues around the vaporization delivery method that go a bit beyond cannabis from a medical setting and into more conventional vaporization combustible settings as well. I think that's a much larger issue being tackled at a government level, where from what I understand, vapes are currently banned in India. They have been for the last couple of years. There doesn't seem to be a consensus amongst health officials about its health benefits in terms of transition time. But I think it is an eventuality in a medical therapeutic setting in cannabis. I believe over the next course of the next, say, 5 to 7 years, we're actually going to see that a breakout into a more pharmaceutical allopathic setting where vaporization methods may become common in the due course as well. But it's still quite a while away, I would say.
Fine, fine. Thank you for this clarification. And on that note, I again thank all of you for taking your time on this Friday evening. And again, it was a very motivational and encouraging response from all the audience. The numbers which we are getting on every session, the registrations which we are getting for these kind of events. We will definitely ensure all of you who have registered for this event will get your e-certificates as soon as possible. And again, we thank Dr. Prashant Jain for taking his time and delivering this wonderful talk and presentation on the topic today. And again, a special thanks to Jahan uh, from Bombay Hem Company for ensuring these kind of sessions are happening on our platform. And gradually, this kind of information, these kind of aspects which has been discussed today, and I can see the feedback from the audience that all of them have liked as far as this particular session was there. And I request all of you to share. You have joined, if you have joined late, you can share this with your senior, junior, batchmates, and all. This is available on our Facebook page, on our YouTube channel, everywhere. You can just click on the link and share on your respective profiles. It is available on my LinkedIn profile as well. So if you are watching on LinkedIn, you can share from there also. So please share this, please share and spread this information across your communities, across your groups, so that everybody will like be benefited. And on that note, I would like to conclude today and thank you again, all of you, for joining. We'll be coming up with another informative session in the next session. And thanks for your time and have a happy weekend for all of you. Thank you.
Thank you so much, everyone. Take care.
Thank you so much, Avi. Thank you. Thank you.